Let's talk about the mucus plug, okay? Do you need to worry if you lose your mucus plug before your due date? Do you need to bring it in with you to labor and delivery? Do you need to take a picture of it? All of these things, let's go over it. The mucus plug is a collection of mucus that forms in the cervical canal in early pregnancy, and it basically acts as this kind of plug in the cervix to prevent any bacteria or any infection from reaching the baby in the uterus. When you get closer to your due date, you will actually start to lose this mucus plug as your cervix starts to kind of dilate or get ready to dilate. You can't have that mucus plug kind of sitting in the way of the birth canal for the baby to come out. When you start to lose your mucus plug, you don't need to bring it to the hospital. You don't need to call the hospital. You don't really need to do anything. You just keep an eye on it. This is something that will happen when you get closer to your due date. Even if you're a few weeks before your due date, sometimes it will start to come out and then it will actually regrow. So it really doesn't mean anything. Some people think that if they lose their mucus plug, they're actually going to go into labor in the next 24 hours. And sometimes that is the case, but a lot of times it's also not the case. So don't be alarmed if you lose your mucus plug before your full term. You don't need to call the hospital. You don't need to do anything like that. And please don't bring it to the hospital. I've had patients do that before. And we just have a good laugh because we don't need to see the mucus plug. We believe you. Sometimes with your mucus plug, you might notice a little bit of pink bleeding mixed in with the mucus plug. This is usually pretty normal. But again, if you're worried about it, always go in to get checked out.